Hi, I'm Dr Natalie of Dr GoFigure, and today's YouTube and podcast is all about sugar. Now, have you ever wondered why there is no diet out there called the high sugar diet? We've got high fat, we've got high protein diets, we've got combinations of everything, but we never talk about the high sugar diet. And that is because our body has absolutely no need for sugar at all. We are perfectly capable of surviving without any sugar in our diet. In fact, our body is brilliant at getting sugar from things like protein. Who knew? So as a consequence, there will never be a diet marketed as the high sugar diet. However, I would say probably most of us are on the high sugar diet. Something like 20 to 35 teaspoons a day is what most people in the Western world will take in their diet every single day. And when you think that we don't need sugar at all, that is insanity. So we're going to really dig deep into what sugar does to our body and why we should think about reducing it, especially as we're trying to think about weight loss and especially as we think about long-term health. So I promise you, when I was writing this podcast on YouTube, I was sitting in a French hotel room and there was this little box of delicious French treats literally winking at me. And I think normally I would have caved in and just eaten them. But I think the only thing that stopped me was the fact I'd been researching just how bad sugar was for me. So I was like, oh no, I can't possibly have that in my body. But that would not be normal. Under normal circumstances, I definitely would have been putting my little mitts into that little box and partaking in those delicious sugary treats. But when we get into this podcast and YouTube video, we're going to start to understand why it was the right move for me to basically resist and say no. So why is sugar such a problem in our diet? Well, the reality is that sugar basically rewards us. So we've got a pleasure center in our brain, and every time we eat sugar, we release dopamine. Dopamine is the same substance that gets released if you say one big gambling or lots of gamers will get a dopamine hit. Every time something great happens, you'll get a little hit of dopamine. And it's exactly the same thing as sugar. Every single time you have that little sugar hit, you get a little rise of dopamine. The brain really likes it, so it will send you looking out for a little bit more sugar. And again, this all comes back to how we evolved. When we were cavemen, if you were able to find fruit, which actually wasn't that common in our diet originally, the fruit had got sugar in it, and our ancestral brain loved sugar. And the reason was because sugar was easily stored as fat. So finding fruit on a tree or on the bushes was something that was really programmed into us, because when you were going to be worried about surviving through the winter, anything that was going to store itself as fat was going to be a good thing. So our brain is programmed to go and seek out the sugar. The reality is, though, as a caveman, we had barely any sugar in our diet, and of course now it is absolutely everywhere. So our brain's programmed to want the sugar, but it's doing terrible things to our bodies. And when we're thinking about weight loss, obviously, we are thinking about how do we burn off the fat. If we're constantly fueling our bodies with sugar, our bodies never get a chance to burn the fat off because it's got readily available energy. And this is what we were talking a little bit about in our intermittent fasting podcast, whereby if we actually gave ourselves space in the day where you're not constantly eating or just adding a little bit here, grazing, snacking, all of those things, where we're constantly basically topping up sugar levels, we'd have more of an opportunity to get into fat burning mode. So I am going to be advocating during the GoFigure program that you really think about reducing your sugars. And it's not just about weight loss, it's going to be about all the other things we're going to talk about. And I know how difficult cutting sugars is because I love sugar, okay? I love my chocolate, I love cake, I really enjoy pudding. And even on days when I've thought I've been really, really good about not having very much sugar, if I go back and have a think about what I actually ate, I do realise that I've basically eaten far more sugar than was necessary. And if you're somebody that's used to having a lot of sugar in your diet, then I think going cold turkey can be quite difficult. And you can go cold turkey if you want to do, but I'm just going to warn you that you might feel a bit rubbish to start with. Bearing in mind that basically the sugar is all about the pleasure centres and that little dopamine hit, you could find that you've got a lower mood than normal. You could find that it triggers a little bit of anxiety. You might find that you get quite grumpy because you're not constantly topping up your energy levels with sugar, if that's how you usually eat. And it can affect sleep, even though in the long term, having less sugar in your diet is probably going to help you sleep better. In the short term, you might find that you're sleeping less well. So you might find for the first few days that generally you feel a bit rubbish and haven't got the same energy and you're grumpy with everybody, but it's definitely worth persevering with. So sugar massively messes with your energy levels too. So if you are somebody that starts your day with a bowl of sugary cereal or some white toast and jam, what's going to happen is, because these are high sugar foods, you eat them, that immediately gets your blood sugar to raise. Then your insulin comes out because your insulin doesn't like your blood sugar too high, and the insulin just starts packing that sugar into the cells of your muscles and your liver. But insulin often works very, very well, especially if you've eaten something with a lot of sugar. So what happens is, after about 2 hours, your blood sugar will drop, and then that signals back to your brain that you're really hungry, and sometimes you can feel a little bit lightheaded and a little bit shaky at this point, even though you only ate 2 hours ago, and your body is literally like, I've got to eat, I've got to eat. So you go looking for something that you know is going to satisfy that low blood sugar feeling, which is something with sugar in. So you grab maybe a muffin or something sweet to eat, and this is going to start the whole cycle again. So your blood sugar rises, your insulin comes out, your blood sugar drops. And lots of people will go through their entire day feeling like that. They literally are lurching between high blood sugar to a crashing blood sugar, to high blood sugar to a crashing blood sugar. And it's basically a very exhausting way to live, and it really messes with your emotions too. You've either got lots of energy or none at all, so you're up and down all day long. And what GoFigure is going to start teaching you is how we can eat better so that we have better energy levels throughout the day. That's going to make us much more effective and efficient. So that's another problem with having too much sugar in your diet. So something you may not be aware of is that actually too much sugar in your diet can affect your joints and can increase inflammation around your joints. And this is because sugar increases a pro-inflammatory substance called cytokines. Now, people with arthritis already have high circulating cytokines, so they've already got joint pain. But if you then add in high sugar to the diet, it means that you're exacerbating your existing arthritis and increasing joint pain. So if you're somebody that's got arthritis or somebody that's suffering with joint pain, then definitely think about reducing the sugars in your diet. I've been a cosmetic doctor for the last 15 years, and obviously I spend most of my time looking at people's skin and helping them with lines and wrinkles. But did you know that too much sugar in your diet is also affecting your skin? Now, people who suffer with acne may appreciate that if they have too much sugar, their skin worsens. And this is because the insulin also promotes increased activity of your sebaceous glands, which are your oil-producing glands in your skin. So your skin becomes more oily, which is part of the cycle that's happening in acne. Now, it's not just about acne, it's also about premature skin aging, because a process happens in your skin called glycation. So if you have got glucose molecules sitting in the skin, they attach onto your protein molecules of collagen and elastin. Now, collagen is what makes your skin nice and plump, and elastin is what makes your skin tight. If you've got glucose added into this and you get this glycation happening, it means that it's affecting the collagen and the elastin molecule. Your skin is less plump, becomes more rigid, starts to sag a little bit. This is where we start to see more lines and wrinkles, and there's also a potential discoloration of the skin that happens too. So too much sugar is not just about putting on weight and then creating saggy jawlines, but it's also affecting how your skin ages too. Lots of people suffer with bloating and trapped wind and rightly put it down to what they've been eating, but most people are not associating these symptoms with sugar. Now, sugar is definitely causing some of these problems if you've overeaten sugar, and the reason being is because normally sugar's broken down in your small intestine, but if you've eaten too much sugar, it means it's passing through to the large intestine where it's causing a growth of bacteria, which is adding to this bloating and gassy effect. So definitely reduce sugars if these things are happening to you. It can definitely make life feel a little bit better. Sugar also affects our immune system. So if you're somebody that's been quite careful throughout COVID and you thought, I'm going to go to bed earlier and I'm going to take my vitamins and supplements and I'm going to walk more and all the things that we now know will boost your immunity, these things can get undone if you basically have too much sugar, because for about 5 hours after something very sugary, your whole immune system dampens down. And this is because the sugar is activating a protein called protein kinase C. Protein kinase C disrupts one of your major immune cells called the neutrophil. Now, I in medical school always remembered the neutrophil as like a little Pac-Man that would come along and it just gobbles up all of the bacteria and the bad stuff. But if your little neutrophils can't work very well, your immune system is dampened down and you will be more prone to having coughs, colds, or viruses like COVID, for instance. So even eating something sugary can affect how your immune system works for 5 hours afterwards. This is also why diabetic people have to be super careful, because their immune system is just generally dampened down because of all of these effects that high glucose is having to their body. Now, you know that I'm always harping on about being worried about having dementia, because half the time I can't remember my words, and I've literally been now on this journey to improve my health so I can improve my memory and my brain. And sugar is a massive problem for brain health. And it's because sugar is a vital source of energy for our brain. We can use other sources of energy. We can use ketones, which are released from fat, but our brains have become to rely on glucose because that's the most readily available source of energy that most of us have. So the brain has got lots and lots of glucose receptors on them. The issue is, if again you eat too much sugar, you actually flood the brain with glucose and the receptors will just shut down temporarily. They'll be like, no, got way too much, don't need any more, so they shut down. But as a consequence, they'll mean there's a bit of a lag time afterwards when your brain actually isn't getting the energy it needs, and this in itself can lead to brain fog. Now, there's a lot of scientists and doctors now that are really associating with high blood sugars with dementias and Alzheimer's. And in fact, these memory problems are now being considered diabetes type 3. That is how bad sugar is for our brain. And honestly, that to me is probably my most compelling reason to really think about reducing my chocolate intake. And I think really the final reason why we have to consider our sugar intake is all about diabetes. It is massively on the rise, and that's because obesity is on the rise. In fact, it's called diabesity in some circles. And what happens is, if you are used to having a lot of sugar in your body is constantly having to produce the insulin in order to take the sugar out of your bloodstream and put it into your cells. Now, over time, all that happens is that you're going to weaken the pancreas. The beta cells in the pancreas that are making the insulin won't be able to keep up with the demands that you're putting on it, and at some point they will just give up, and that's when you'll get diabetes type 2 that you need to then take insulin for. Now, the reality is, if you don't look after your insulin levels and you're having to take them by injections, if your blood sugar rises too high, it will kill you, and it kills you quite quickly. So basically, glucose in the blood is entirely toxic, and our bodies are well adapted to dealing with this ourselves. But if we take too much and start affecting our ability to make the insulin to keep up with our sugar demands on the body, we will put ourselves at major risk of getting diabetes type 2. Now, there's something called insulin resistance that occurs before the beta cells give up in the pancreas, and this is called insulin resistance. And this is basically where your pancreas can't keep up with the demands that you're putting on it, and your insulin is becoming less useful in the body. The sugar's too high, the insulin's not working well enough, and this is called insulin resistance. Fortunately, both diabetes type 2 and insulin resistance can be reversible. And I think this is incredible. because all it takes, it doesn't take us having to take a lot of medications, it takes lifestyle changes, which is obviously what we're talking about here. It takes you thinking about your diet, thinking about reducing your sugars, giving your pancreas a rest so that your pancreas and your insulin levels can start coming back to normal levels. And that is definitely one of the messages of today's YouTube and podcast. It's really about the fact, as I say every single time, your health is in your hands, and there's a huge amount you can do to help yourself. So if you're somebody that's worried about getting diabetes, or you are already insulin resistant, or maybe you already have been diagnosed as diabetic type 2, if you're not having to take external insulin, i.e. insulin that you're injecting, then there's a very great chance that you can reverse your condition through lifestyle and exercise changes. Every single week, I love to give a little bit of homework. So guess what this homework's going to be this week? It's all about reducing your sugars in your diet. And I think most obvious place to start is just thinking, if you're having cakes and biscuits and chocolate and sweets, that is just the first place to start cutting down. You don't need this as a fuel source. Your body doesn't need the sugar. Plus, because of the way we all live, you're already going to have loads of sugar in your diet, whether it's because you're getting fructose from fruit or lactose from milk. These are all natural sugars. You're going to be getting natural sugars in your diet anyway. So when you start cutting out the really obvious ones, it makes a huge difference, not just to your weight line, but it's also going to make a difference to your diabetes risk and your brain health too. On a side note, I just wanted to explain what's taken me ages to get my own head around. Okay, I could not understand why people were saying that white bread and white pastas and white rice were so bad for you and were basically going to spike your blood sugars, because I was like, but they don't taste sweet. What's going on here? And what it is to do with is the fact that they don't contain very much fiber, so your body breaks them down really quickly. And this is the crux. Your body breaks down, say, white bread really quickly, and it releases all of that energy all at once, and that's why they spike your blood sugars. So even if stuff doesn't taste sweet, it can still have the same effect as eating basically sweets, and it's to do with the fact that your body doesn't take more than, probably does take more than 5 seconds, but it doesn't take very long to just release that energy. Then you get the blood sugar spike, and then you'll get the crash that follows as well. So one way to start reducing your sugars is to think about taking the wholemeal pastas and the wholemeal breads and the wholemeal rices, because they've got more fiber in them, and it's much more difficult for your body to break these down. And because it's more difficult to break them down, it releases the sugar more slowly, so then you'll get basically a much more even blood sugar throughout the day, which is definitely going to impact your energy levels and also your mood. So in order to reduce your sugars, I think partly you're going to have to be a bit more organised in your day. What you don't want to be is you're kind of running down the high street, you're suddenly starving hungry, you run into the local shop, and before you know it, you've got something sweet and sticky in your hand, thinking that's going to solve your problems. Think about meal planning. Think about the kind of carb sources that you're using. So try and to take out your white carb sources for the wholemeal ones. And also just be a little bit organised. If you can know what you're having for breakfast, and then you've maybe got a lunch prepared, and you know what you're going to have for your dinner, you're going to be far less likely to sort of fall off the wagon and end up down the sweetie aisle. If you do have to go to the shop because you're feeling hungry, then obviously a piece of fruit is going to be far more beneficial because it's got more fibre in it, and it's going to take your body longer to release the energy from it. So that, in a nutshell, was my quick scamper through why sugar is so bad for us and why we need to have a rethink and reduce our sugar intake. So as per always, I hope you've really enjoyed this episode, and please join me next week. And until then, have a very happy and healthy week. Remember, if you like what you see, then please like, share and follow, and you can keep up to date with absolutely everything that we do.